Hi, my name is Whitney with Eyefinity, and today I want to spend some time reviewing with you the built-in efficiencies that you have available to you when you upgrade your practice management software to Eyefinity Practice Management, or EPM as we know it. EPM is Eyefinity's cloud-based point of sale system. It's going to help you manage your appointment calendar and confirmations, your patient records and demographic information, manage your insurance, allow you to order place your orders in the optical with glasses and contact lenses, manage your frame inventory, and then on the back end, manage all of your claims that you are trying to submit to insurance, and of course, give you some great financial reporting and practice reporting to help you manage the business. Today, in addition to that, I want to discuss how Eyefinity allows you to be on the go and to have access to the system wherever you are, either on the computer or on the tablet, so that you can be mobile as you place optical orders in your practice. I want to discuss online scheduling and our optional texting service that we can add to the system for you. And then really what it's like to navigate the system in a common sense way. As you go into a patient's record, you have all the data you need right in front of you to know what you need about the patient, and then also to take care of your patient as well. And we'll talk about the built-in VSP integration for those of you who are VSP providers, and then spend a little time in optical order management and discuss how we structure our optical orders so that you can navigate quickly through the system. You can send and electronically send off your orders to the lab, to connect similarly to ABB in order to send those contact lens orders off, and then have the data available to you in order management so that you can track those orders as they come back in the system. I think what you'll find with EPM is that it is a full point of sale system specifically designed for the optical, of course, with the added layer of managing your insurance as well. So first thing on the screen, just for our purposes of the demo today, I want to show you that you can easily toggle through these large tiles you see on the screen. This is all the major area of the system, and you can easily get through to any of these sections by using your computer with your mouse or touchscreen with your finger. Next, I want to take you to the appointment calendar. So what you'll find is that based on your resources, so who is seeing patients today, you're going to be able to go in and see their available appointments, and then or not available appointments. Here I've got some that are grayed out, and then available appointments later in the week for this particular provider. That's on a week's view. We can also look at today. I don't have availability today, but you could see the options there. And then when I want to schedule an appointment for a particular provider, in this case for Whitney Smith, I'm just going to hover over the time slot I want, maybe at 10:20 on Thursday, double click, and then bring in my patient, Natalie. From this screen, I can go ahead and see a quick snapshot of her information. So I have the data I need to verify who I'm working with, and then also be able to bring in very quickly why I want to see this patient. Do we have any insurance that's on file? In this particular case, I do have a couple of policies that I can choose from, but if I didn't know that, I can add insurance from this screen, and even check for VSP insurance from this screen, which is really handy if you're not sure if a patient has a VSP policy or not sure what insurance they have. Based on the information we have preloaded in the system, you can click on check for VSP insurance, and it will determine if the patient has a policy or not. I'm going to choose VSP today just for example purposes, and then in a few minutes I'll show you how to use that VSP integration. We can also add a secondary medical insurance, and then when the patient comes in, we can go ahead and check them in and move them through their appointment status. And if we've confirmed that appointment, we can also confirm it here as well. So once we click save, we're going to see a couple of things here on the screen. With Natalie and her appointment, it also gives us some little icons. So we know right away with this little sticky field with this the red icon here, it looks like she has a balance on her account. We've confirmed her appointment with that C. And then with the I, we also know that insurance is involved. But one other area, one other icon that could be here is a cloud icon, which would tell us that the patient had scheduled their appointment online. And that is a feature that we offer to all of our practices through eWeb Extra, which is our website platform that we give you as a part of your purchase. So meaning that we can host your website for you if you want. If you have a website of your own, that's okay too. We can also add in online scheduling to your current website or the website that we provide to you, either way. But your patient can schedule online, and you can see that in your appointment calendar. You could come into all of these appointments and see the little cloud icons and know very quickly how your patients are utilizing that feature. So let's go back into Natalie's record really quick. This is going to take you to everything that we could do for Natalie. We can see information about her. We can schedule an appointment. We can update her insurance, load in any prescriptions, charge her for glasses, contacts, or exams or accessories, and then load in any documents as well. And that data, what I just went through here, is everything that runs down the left-hand side of the page. And so I think what you'll find is when you log into a patient's record, it is very self-explanatory, the items that you can do for her. And they all run down the left-hand side of the page. And then whatever area you click on, that data will be here on the right. So I'm in the overview right now, and so I can see quickly Natalie's picture. I can see her contact information. I can see where she is in appointments, recalls, orders, prescriptions, any notes that I've left about her. But we can also see if we have any family members linked to her account. This is important because we can update information in maybe mom or dad's record and flow that data down into anybody that is attached to her account, maybe family, dependents, children, or a spouse. We can also set up family payments in that way. So if we knew that we were taking a payment for Natalie, it would alert us if anybody else in the family had a payment as well. And then also on this screen, it lets me know any balances and if she has a pending exam for my Eyefinity EHR that I need to price. Now I want to show you with insurance really quickly how that VSP integration works. So in this screen, I already have a couple of VSP policies listed in an iMed policy, but if I were to check, if I didn't know that she had VSP, I could click on check for VSP insurance. It would go out to eyefinity.com and electronically pull in any policies the patient has. I already have them listed here today, so it's not going to duplicate, but they would electronically load if I had to not have them listed here. And then when we bring in other insurances, we can just click on other insurance, look for that insurance, and attach it manually. With eligibility and authorizations, I have the ability to come in and authorize right in the system for the VSP authorizations that I need. So in this particular case, I want to show you an optical order. So I'm going to authorize for frame and lenses with their VSP signature policy. And it is going to pull in electronically an authorization number that I would have obtained on eyefinity.com and a copy of the patient record report, which is what I also would have obtained based on their policy and the pricing information. So this is electronically connected. Other insurances, I just click on eligibility and copy and paste in any authorization number that I've obtained from the carrier's website. So that you can track it, you can attach it to an order, and then know when you go into claims management that you need to file that particular insurance yourself. Immaterial orders, this is where basically the command center for anything financial is listed. We can see right away if the patient has a balance or a credit on their account, all previous orders or non-invoiced orders, which are like orders we put into the system kind of queued up, but they haven't been checked out yet. This is a really nice option if your front desk puts in charges, maybe in waits for your optical to put in charges and you check the patient out together. You have the ability to queue up those different orders and then generate the invoice with all the charges for the day on one invoice. But for example purposes today, I want to take you through an eyeglass order and show you how to use that authorization that we just pulled from VSP. I'm going to grab that VSP authorization, and then the system is going to walk me through building the package from the optical. And you can already see these large tiles that I'm navigating through. That really helps you if you're using the iPad. We're going to grab our prescription, and these prescriptions come over electronically from Eyefinity EHR, and then we'll walk through building the package. So I'm going to grab a frame that I want to use for this patient. You're just going to search by model number, and because of our integration with frames data, all of the information about the frame pre-populates. We're going to choose down at the bottom how we're going to impact inventory. I'm choosing lab supplied today so that it will not take an amount out of my inventory, but if we chose doctor supplied, it would take one from our physical inventory count. Based on my single vision -2.25, -250 prescription, the system is only showing me those lens options in that power range. And I'm going to choose the product that I want to order for this patient. Bring in my measurements, add any lens treatments or coatings down here at the bottom. We also have an extras option. So if you charge for things like prism or oversized lenses, drill mount fees, that kind of thing, you can add those charges to the order. And then lastly, our lab integration. So in this case, I'm going to use a VSP facility because it's a VSP job, but we also electronically connect with many labs. It doesn't necessarily have to be a VSP facility, and we can electronically send off those orders for you. This is just a quick review of everything that we've put in the system already, and I'm just going to continue to the pricing. In this screen, what I need to do is to take the retail price that's populating and override it with our insurance. With the VSP integration, it is going to calculate the benefits for me. It's going to tell me what the patient should pay based on each line item and also what I can expect back from insurance, even including the chargebacks. Now, with other insurances, you'll find that this matrix here is editable, and you'll come through and you'll, based on their policy, notate what the copay and each line item in the patient responsibility should be. And then save, and that will override that price point and only charge the patient what their policy says that you should charge them. And then we'll invoice the patient, take a payment. Of course, you'll have a list you can choose from however the patient would like to pay today. And then when we save, right before we get the itemized receipt, it is going to populate the best question, which is, in this case, you have a VSP claim and an order that needs to go off to the lab. Are you ready to go ahead and process that now? And if you do, it really eliminates an entire step of having to go out and file that claim and order that job. It will do it all for you here. I'm going to process the order now, and the itemized receipt is going to populate for me so that I can print this for the patient and move on to the next patient. Now, the last thing that I want to show you here on the screen, now that we've taken a look at our on-the-go, the access, the appointment scheduler and online scheduling, how to navigate through the patient's record and the built-in VSP integration. The last area I just want to point out very quickly is optical order management. So you're going to have frame inventory that you'll be able to load in all of your inventory into the system as you get those orders in from the manufacturer. And then, of course, as you want to run physical counts throughout the year, you'll have that ability as well to make adjustments. And then, of course, to run reporting on all of that. That will live in the frame inventory section. And then lastly, in order management, just want to point out that every order that you're placing in the system for glasses and contacts are going to come into a queue so that you can work those. They come back in from the lab, you can receive them in, and then if you have our texting feature turned on, it will automatically text the patient and let them know that their glasses and contacts are ready for pickup. Same thing too with that functionality will happen to confirm appointments you have on your appointment calendar, and then also to update the patient and let them know it's time to schedule their appointment for the year. So definitely talk with your Eyefinity rep about that. They can discuss that add-on option for you. And that concludes today our quick demo of Eyefinity Practice Management. We wanted to show you built-in efficiencies that are available to you as you think about upgrading your practice management system or point of sale system and to Eyefinity. We want to be available to you. I think you'll find that our Eyefinity reps are a wealth of knowledge and happy to help you in this process. Thank you and have a great day.